During the course of yesterday, 1,487 COVID-19 infections, including 23 imported cases, were confirmed in Sri Lanka. The Kaluthara district accounted for the highest number of infections with 217 new cases. Meanwhile, 213 fresh infections came from Galle, 164 from Colombo, 126 from Badulla and 102 from Gampaha. The remaining 20 districts accounted for 642 new infections. There were also 43 COVID-related deaths yesterday as well. The Sri Lanka Medical Association, meanwhile, expressed concern that there are more COVID-infected persons in the community than what the official numbers suggest.
There are many places that would be high risk to create another cluster of COVID-19 infection, such as weddings, religious places, religious cultural activities, cinema, public transport, musical shows, restaurants, bars, etc. If there is an environment, enclosed environment with air conditions on, those places could be at very high risk of spreading the disease. When we get about 50 deaths per day, one could calculate at 2% death rate in COVID infection, 10,000 infected people in our community. Our impression is the number infected is much more. As such, it's important that we improve the care given for these patients. To reduce deaths, the patients have to understand that they should reach hospitals early, they should seek medical advice early, and the facilities in hospitals have to be expanded, and there has to be facilities for asymptomatic patients to be managed at home so that you leave room for more seriously ill patients to have proper care from hospital setting.
Meanwhile, there is criticism over the number of daily PCR tests falling drastically in the recent days. Yesterday, 12,039 PCR tests were conducted. From the 21st of June to the 28th of June, however, the daily PCR tests remained within 18,000 to 20,000 range. From then until the 5th of this month, the daily number of tests fell between 15,000 to 18,000. From then on until last evening, the daily PCR tests number ranged between 10,000 to 15,000. Though the numbers have dropped, there looks to be something more scientific behind it.
In the recent past, they have changed the indications, the reasons or the indications that is needed for PCRs. Previously, when we see the daily data, about 80% of PCRs were what we call exit PCRs, PCRs of people who were leaving the quarantine centers or hospitals. But now what they have done is many of those are replaced with the rapid antigen test, and PCRs are done. Now when you say that 13,000 PCRs, those PCRs are the PCRs of patients who appear to hospitals as well as the PCRs done in hospitals. So the information that you could gather out of that data is little different to what we used to have in the past. And also, now they have distributed these PCRs among districts as well as among the places, say for hospitals and likewise. So I think that if necessary, that we could increase the number of PCRs, but then as we go by the proportion, I think that now it gives a better reliable information, though it does not give accurate, precise information. It gives you information with regard to trend more reliable than previously. There is a ceiling that any government could do. So I think that what is most important is to decide the levels in a most sensible and the most profitable manner.
In the meantime, people above the age of 60 and those suffering from chronic health conditions are urged to exercise maximum caution even after vaccination.
We have seen up to now the people who have succumbed to the disease, about 84% have been above the age of 60 years. And out of that, 54.9% have been diabetics. 51% of the patients have been hypertensives. And others with strokes, ischemic heart disease and other chronic conditions are also in that list. So if you take that category of people, you have to look after yourself and avoid places where there is a high risk of transmission. Just getting the vaccine also won't do. You must give your body to mount an immune response, which will take about 2 to 3 weeks. And in a patient with comorbidities, it might take a longer period even, because some people are slightly immune compromised, people with chronic kidney diseases. So you need to give some time to get the full protection. Until that time, please control your disease conditions, whatever that may be. People who have diabetes, try to keep your sugars as low as possible. But we know that when you have sugars above 180, the risk of dying from the disease and getting complications goes up to about 10 to 11%. And if your sugars are around 100 to 120 range, your risk comes down to 2%. So this is a risk reduction that you can do it yourself.
As for today, 1,062 new COVID infections were confirmed, taking the number of active cases in the island to 20,826. On the COVID-19 recoveries front, there were 980 today, taking the overall tally to 262,828.
පුංචිම දෙයකින් ලොකු වෙනසක්. සැෂේ වලට වඩා සංසිල්ක් ලොකු බෝතලෙන් රුපියල් 20ක ඉතිරියක්.